we're going to start with Lisa Johnson from BayCare. She is a nurse, but she's about to retire also, and I am very grateful for her making the time in her very busy schedule to come and share with us. We all went through a crisis. Do you know there's a lot of different types of crises? She has some secrets for success for all of us. Lisa.
I think I've had to move the mic down the most, so just let everybody know. But really, thank you for having me here today. What an honor. And I've just been sitting here in awe. Seeing everything that you all are doing, the future is so bright. So thank you all for everything that you're bringing to the table. Much appreciated. But I'm Lisa Johnson. I'm the Chief Nurse Executive for BayCare. And I've been with BayCare for 35 years. And BayCare employs over 31,000 people. My team is 10,000, about 10,500 folks, and about 8,000 of those are nurses, and some are from Hillsborough Community College, which we have a partnership with. So I've been a nurse 42 years. This basically means I'm really old, but let me share with you a little bit about BayCare. Make sure I'm moving these. Okay, BayCare Health System, it was formed in 1997. So actually, I started before BayCare even was formed at Morton Plant Hospital. We serve 4 counties in the Tampa Bay area all the way over to Polk. It's 16 acute care hospitals. We have approximately about 2,700 patients, hospitalized patients every day. We see 600,000 ER visits, 77,000 surgeries, both in our hospitals and our ambulatory centers. And the happy note is we do about 13,000 births each year, which is, that's the happy time. But, I think all of us I know the whole nation, the whole world, we went through a not so happy time, and that was the pandemic. And I think about the pandemic, and I think about when y'all were talking up here about the schools and trying to, totally switch gears on how we deliver education. I do have to lean towards, I think that bedside critical care nurse may have been the hardest hit because they were right there on the front line. So I want to, so that's BayCare. This is my beautiful little granddaughter, Tegan. Tegan is, in that picture, it was her 6th birthday. And March 14th, 2020, that's the day I knew this was big, and this was real, and it was really big, the pandemic. The day before this birthday party and this picture, President Trump had announced we were in a national emergency. So many people did not come to Tegan's birthday party as a result of that, understandable. But I could remember her in her little unicorn outfit with her hand on her hip, and she said, "Grammy," she's very dramatic, this virus has ruined everything. And wow, how profound that was, the sweet words. I get emotional. That little 6-year-old. What we didn't know at that time, we had no idea it would take 3 years for us to return to a normal, but not the normal we knew, a new normal. So that same day is the day our senior leadership team began having calls. It was a Saturday, 12 noon, began us planning for this pandemic, something none of us had ever, as with everyone, none of us had really planned to deliver health care in a global pandemic, and didn't think that would ever happen in our lifetimes. So how did we go about doing that? So here are some of the key elements, things that we had to take on. But first, starting with communication. After hearing you all today, I feel like these people don't need to hear this. But I'll continue on because I have it all prepared. But it's about communication. And there was not you just can't even imagine how much massive communication had to take place, just as in your all's businesses also. But we had to communicate with our team. We also had to communicate with our community. Our community is looking to their healthcare provider for answers we did not have. Capacity. My goodness, we were sitting around tables looking at, could we put 7 beds in this classroom? Could we fill the auditorium? Do we have enough beds for that? And later, which is a very sad thing, and I don't mean to be doom and gloom, we were looking for capacity later in the pandemic in our morgues because so many people had passed away. So those were tough days. Resources. Did we have enough people? Workforce shortage for sure. But so all hands were on deck. All the educators, all the leaders, we were out there supporting the bedside. They won't allow me to directly care for patients anymore. I'm just kidding, but I was out there trying to support the team. The other thing that we were doing is we were setting up testing sites for our community. We'd never done that before, pop-up clinics. Then later for vaccines. I was actually given vaccines. They did allow me that after a direct observation and training, but it was all hands on deck. Equipment, this was huge. We were seeing what was happening in New York. I mean, this was just such an overwhelming, frightening time. We were seeing what was happening in New York. They were running out of ventilators. And we're like, do we have enough? So, of course, inventory on that. Did we have enough masks and gowns? Because we were hearing other places didn't. And I have to really give BayCare Materials Management a lot of credit. We never one day were short on masks or gowns. We always had our equipment. The other thing is training. Okay, the CDC, every hour it was changing. And so we're supposed to communicate to thousands of team members. Wear this mask, don't wear this mask. Wear this gown, don't wear this gown. Put this sign on the door, don't put this sign on the door. Let the visitor in, don't let the visitor in. So they thought we were crazy, and we were, because we really didn't know what we were doing, but we were trying to do the best we could do. Managing fear. Looking at the deer in the headlight looks of our nurses and caregivers, and it wasn't just nurses, it was lab, it was respiratory, the fear in their eyes behind that mask. Also, our critical care nurses were losing patients every day. That took the biggest toll. We had never experienced so many deaths of young people, and that was really the emotional toll it was taking. The other thing, as with the rest of the world, we were having to make quick decisions. So, what got us through all this? In the midst, what really sustained us and what helped us to move forward? Well, I'm very proud of BayCare. Obviously, I've been there 35 years, and this, I'm sure, holds true in your organizations too. But we have dedicated leaders. We have teamwork at its finest. We have community support. We have collaboration from others. We learned a lot from people who experienced the pandemic before we did, or the surges that we had. We had quick mobilization of resources and equipment. Again, all hands on deck, CEOs, COs, transporting patients, whatever we needed to do. We were innovative. We were nimble. We supported each other. But really, the strong foundation of values that BayCare is built upon, and also the financial discipline that we have had, really is what helped us to move forward. So we made it to the other side. Yay. I didn't think that day would ever happen. But, and what we have discovered, and we, again, remember, to instill confidence, we didn't know what we were doing. Okay, but we did make it, and we did find ways to do the right thing for our patients and for our community and our team. So, and what we've discovered is we have recovered as a healthcare system, and remember, we are a large healthcare system. Over 16, at that time it was 15 hospitals, now 16 hospitals. So what helped us to recover that quicker than others? So, as with everyone, we've adjusted to the new world order. That we didn't overcome that. We have workforce shortages still, so we need your team members. And we also, our volume has not returned to the pre-pandemic. It's getting closer, but it's not there yet. And then, of course, cost, labor cost, cost of materials, all that is more. That hasn't changed. But what I think in the walls of our organization and in our system, what I'm grateful for, which I think helped to give us a quicker recovery, of which I have mentioned, is the amazing culture, and I'm going to talk a little bit more about that. I have a 4-hour presentation, just to let you all know, and and a 2-hour video on hand washing. But what got us through this life-altering event is, and I have to give Yvonne, she's one of our board members. Our board members and leaders that before years of dedication of preparing us and making us solid, both in our culture, but solid in our finances, that helped us to get through the crisis. Also, we have resilient and dedicated team members and physicians, and now have developed an even greater bond living through that. We've always been big about investing in our greatest asset, our team members. Can't say enough about that. And tremendous community support, unbelievable community support. So as Yvonne told you, I'm retiring in about 6 weeks, which gives me angst. I don't even want to talk about that. But I'm going to stay on and do some special projects because I have to wean off such an amazing organization. But when you're old like me, see, I don't think I'm old, but I am. I'm supposed to give you all these words of wisdom. So I'm going to talk a little bit about culture and how important that is. So in my last couple of minutes here, I can sense it, I can feel it. Your organizations, you wouldn't be sitting here if you didn't already have the ingredients of a strong culture. But I'm going to talk a little bit more about what that has meant to me, my career, and how important that is to recruit and retain the talent that you all are training. You all are out there training people. We want to be sure that when they come to work for us, they feel good about it. And so that's the culture I'm talking about, and that's the culture we have at BayCare. So 35 years as a leader, working in an amazing organization, degrees, ongoing education, all that is so super important, essential. But what I really know in my elder days here, values, building positive relationships, simply following the golden rule. Those are the ingredients that really make and create a positive culture, sustains a culture through a crisis. It's a solid foundation. And keys to thriving as a leader and employee is to model the behavior you want the team to display, model that behavior, lean in. And as we teach our new folks, the young folks that you all are out there working with and in our colleges, really inspire them to lean in, do more than what's expected, roll up your sleeves and do whatever is needed. That really doesn't go unnoticed. Act in ways that foster trust. One thing I think, and I've really tried to tell my team, is be genuine, be real. We don't have all the answers, and be willing to say that. Can't say enough about reward and recognition. Give others the credit. It's not a competition. Never mistake kindness for weakness. I've worked on that. I've been preaching that. A little girl from East Tennessee. That it's harder to be kind actually, but kindness is what really matters at the end of the day. That's what recruits and retains wonderful people for your team, and it's the right thing to do. So in closing. Oh, I forgot the other thing. And I just mentioned from Tennessee, so I can say this. Never get too big for your britches. So be humble. And so in closing, surviving a crisis, recovering quicker, it's all about a strong culture. It requires exceptional focus, dedicated people, strong values, and it begins at the very top, and it begins with each one of us. Thank you.